Hi, Judith Hanson here. As many of you may know, I'm a clinical hypnotherapist and I'm also a qualified mindfulness teacher. So how do I use these two things when dealing particularly with depression, which is what I want to focus on in this video? Firstly, a bit of background. The reason I learnt mindfulness and learnt to be able to teach mindfulness was because of the evidence base that it had, that it was as effective as the two other most effective ways of dealing with depression. And those two other ways are taking antidepressants for the rest of your life or seeing a cognitive behavioural therapist for the rest of your life. The second one is going to be quite expensive. The first one, a lot of people are not happy with being on those powerful drugs for the rest of their lives. And I can understand why, although I also understand the place that antidepressants play in the treatment of depression. So mindfulness is as good as those two. So it seemed important to me that I learn how to teach it so that I could offer it to people with depression. Now, the key thing with mindfulness is that it is not a therapy. It is a change to your way of life. In order to get the benefits that mindfulness can bring to somebody suffering with depression, they have to establish a regular daily mindful practice. So the program that I run teaches them why they're doing this and how to do it, so that they can continue for the rest of their lives being mindful on a daily basis. What that means is that I can only teach mindfulness to clients who are between bouts of depression. Depression is normally a recurring mental illness. And they need to be between bouts because of the amount of commitment and effort that they have to put into learning mindfulness and establishing that regular daily practice. And that is something that is impossible or incredibly difficult to do when you are in the middle of a bout of depression. It's very hard to be proactive, to take action, to commit to anything when you are in the midst of depression. So I will use hypnotherapy with somebody who is in the middle of a bout of depression. And for those with mild to moderate depression, I'm about to launch a new program called the Hypno Antidepressant, where I have tools and techniques that I tailor to each individual client while they are depressed. As I say, mild to moderate levels of depression, not severe. Having done that, if necessary, and if they want to, they can then go on to learn mindfulness so that they can help themselves to not succumb to subsequent bouts of depression. So it's an either-or approach. Use hypnotherapy, particularly my new program, which I'm very excited about bringing to my clients, and then the mindfulness program when we've dealt with the current bout of depression, or go straight for mindfulness if they are already between bouts of depression. So that really is all I wanted to say on the topic of depression and how I use the two approaches. Next time, I'm going to talk about anxiety and using both of those approaches. So look out for the next video. And thank you for watching this one. Bye.